D.
A,
Oh.
assuming a dependent role. All right, the stage of assuming a dependent role requires assistance in carrying out all activities of daily living, as well as the patient often requires care which may be provided in the home. Experiencing symptoms and assuming the sick role may precede this process. Recovery and rehabilitation are not evident in the patient's present circumstance. A hospital nurse assesses clients in various stages of illness. Which statements accurately describe client responses to illnesses based on Suchman's stage of illnesses?
B, D, E.
A, B, D. Which statement accurately describes the client response to illness?
A, B, C, D.
Okay, so let's look at them. All right, so these behaviors are unique to how people cope with altered function by the disease. They are unique to the person and influenced by the age, gender, family values. Stage 1 is experiencing symptoms, but the client does not define himself or herself as sick until stage 2. So stage 1 was wrong here, okay, because of what it's saying. In stage 2 is assuming the sick role, focusing on the symptoms and the bodily function. Stage 3 is assuming the dependent role, accepting a diagnosis and following the prescribed treatment plan. Stage 4 is achieving recovery and rehab, and this can often occur in a variety of healthcare settings, including the home.
And then D is.
So D is actually stage 3, okay? Because the client decides to accept the diagnosis and follow the treatment plan. That is stage 3. He doesn't actually achieve recovery and rehabilitation in that stage because he's just now accepting the dependent role. So D is not correct. In stage 1, pain is the most significant symptom, including illness, and they may have other ones. So E is true. All right, so B is true. Three is true. C is true. E is true. And F is false because the final stage of illness is rehab, and that doesn't usually happen in the hospital. It does happen in the long-term care facility or in the home. Any question on that one? All right, so B was true, C was true, and E was true in this one. A nurse is caring for a client who has breast cancer. The client tells the nurse, I don't know why this happened to me, but I'm ready to move on and do whatever I need to get healthy again. The client is in which stage of acute illness?
3.
Good, 3. When the person becomes ill, certain illnesses and behaviors may occur in identifiable stages. These help people cope with altered functioning caused by the disease. They are unique to the person and influenced by age, gender, family, values, economic status, culture, educational level, and mental status. By the statement of the client made above, the client is in stage 3 of acute illness, assuming a dependent role. Healthy People 2020 defines health equity as attainment of the highest level of health for all people. It places a lot of focus on promotion of health, prevention of illness. There's still disparities that lead to different health outcomes. So what does this mean, disparities? What it means is if I have a certain health insurance or no health insurance, or if I live in a certain neighborhood, I'm not going to have the same access to other people who have really good health insurance or who live in other neighborhoods. Okay, a huge difference between the care that you can get if you're on Medicaid versus Medicare, right? We know that just in general, just between the two of those. And I also know that if I live in a certain neighborhood, there might be 2 or 3 doctor's offices or hospitals in that neighborhood. If I live in another neighborhood, it's more likely to be full of liquor stores than it is doctor's offices or healthcare facilities. Okay, so the care is not fair and equitable that people can receive to everybody. So a health disparity defined by Healthy People 2020 is a particular type of health difference closely linked with social, economic, or environmental disadvantages. So what the environmental disadvantages are, generally, if I live in a lower income neighborhood, I might have to ride the bus. The bus might not go to the doctor's offices or the places that I need to go to get health care. I might not have the insurance that I need to go to those offices. If you have Medicare or Medicaid, a lot of times, especially with Medicaid, you got to call like 40,000 offices before you can even find one that will even accept it. Okay. And a lot of times, oh, yeah, we accept that, but we don't take new patients. Disparities are influenced by different factors, and that could be race, ethnicity, poverty, biological age, mental health, educational disabilities, sexual orientation, health insurance, and access to mental care. And access to health care. And it definitely is out there. It's not as prevalent as what it used to be. Okay. I used to be in a blues band, and my lead singer was from the South. He was a blues man that was born in Georgia. He was the son of a sharecropper. I'm not sure how many of you are familiar with that, but after slavery time, they developed something called sharecroppers, where the slaves were actually allowed to own a portion of the land that was given to them by what was originally their slave owner. And what they would do is they would maintain that land and maintain the farmer's land as well. And so these patients were treated differently than other patients, even though they were given land and stuff like that after the slavery time. They still weren't given the benefits that the owners of those slaves or the owners of those sharecroppers were given. So if the owner of that sharecropper went to the doctor and they have a problem with their prostate, back in that time, they would have been treated for that prostate problem, and they would have been given, hospitalization and treated. But if that same person that lived on that same property, the sharecropper, went in for treatment, they would have died from something as simple as an inflamed prostate gland, because they wouldn't have received treatment for that in that hospital. As a matter of fact, they wouldn't even been allowed admission in that same hospital. They would have been sent to a different hospital where people, with the same affiliation were treated, and those people wouldn't have received the same level of health care. So one person who could be treated for something and live, and another person with the same condition would die from that same issue. And a lot of that still exists today in this environment, because if I don't have the insurance and I don't have the transportation and I don't have the money, I might as well still be that slave in the South, because I still can't get that care. So Healthy People 2020 is trying to eliminate those disparities. A lot of people in healthcare are trying to eliminate those disparities. Michelle Obama did a huge project with this, with obesity, and try to eliminate those disparities. How does obesity affect the United States right now? Why is there disparities? Why are certain populations more obese than others? Can you guys answer that for me?
Because all the food, all the bad processed foods and stuff.
Bad food is cheaper than healthy food.
Yeah. So if I go to the store and I have food stamps to buy food, okay, and I got to make $500 go for 4 kids, okay, for a whole month. And we all know that $500 for a month worth of food is really nothing. If I could buy 10 packs of oodles and noodles, that's going to give my kid 10 days worth of food, even though it has no nutritional quality. What's more important to me right now? That my child doesn't go to bed and cry hungry, or that they have nutrition? So I have to make a choice. So I have to buy things like macaroni and cheese and oodles and noodles and stuff like that, sell for 10 cents a package or 20 cents a package, because if I go and buy the noodles and buy the cheese and buy the milk, how much is that going to cost me?
Yeah, and it's a lot of it's quick fixes too.
Yeah, it's also that, the latchkey kid. The kid can come home from school and throw the oodles and noodles in a microwave and make it on its own. I don't really have to worry about him burning the house down, right? But I don't want him cooking on the stove. So that could play a part in it too. So you'll see all types of different disparities. And, how does it affect health? How does it affect the patient's access to healthcare? How does it affect, uncontrollable blood pressure in these kids that are now, 60, 70 pounds overweight? They now have diabetes, and they now have uncontrollable blood pressure because of the amount of sodium and processed foods that they're shoving into their body every day. And then on top of that, it's not even safe for you to allow your kids to go out and play in the park or go out and play unless you're right there with them, because you have to worry about all these sex freaks out there trying to hit on your kids. So you don't even want the kids outside engaging, and on top of that, the video companies have, got the kids so engaged in these video games that even if you wanted them to go outside, you can't get them off the video games to get them outside. So, you have all these different disparities. Now, does obesity, does developmental disabilities or physical disabilities, does that affect someone's ability to receive health care without prejudice? Because what's an automatic assumption that people make when you come in the office and you're obese?
That you got diabetes and all kind of other health issues like hypertension and all that stuff.
Do you think that that's the assumption they make?
No, they assume that you're
you just
overeating.
eat and you're eating.
They assume that you're overeating, that you're lazy. What else do they associate with fat people? Let's say
That you're unemployed.
That's what they look
job.
at you. Exactly. They look at you. Oh, here comes this fat, lazy bee on welfare. Probably got 7 kids. That's how they look at you when you come through the door. Okay. And right away, they don't want to help you because you don't fit into their little perfect clique of how they want you to be. You see it all the time on TV. Like you just now started seeing on TV Black people and white people interacting. And I'm talking about men and women of the opposite sex. You just now see them putting shows on TV with bigger people. Before you had to meet a certain criteria to be on TV. Even with singers, professional singers, right? Now you see big singers and stuff out there. But back in the day, those singers weren't that size. Very rare would you see a singer that was obese on stage, because they wanted you to have a certain look, a certain click, a certain way to fit in. And it doesn't just fall down to the way you look, it falls down to educational and financial status as well. So you're working in the community and you're assigned to care for several clients. You recognize which clients are more likely to experience barriers to access for adequate health care. So which ones do you think would have more of a problem getting health care?
B, D, and E. Well, no, B and D.
Okay, so everyone, regardless of age, gender, level of education, religion, sexual orientation, social position, is entitled to equal services. Disparities exist among various groups, including the poor, unemployed clients, racial or ethnic minorities, migrant farm workers, those affected by gender differences, older adults, and people with disabilities. Okay, so B, the migrant worker, C, the older adult, and D, the client unemployed for 6 months. So what kind of factors affect our health and illness? So our basic human needs, the things that we need for survival, okay? And these are emotional and physiological needs, all right? If they go unmet, all right, it could cause us an issue. It could put us at an increased risk for illness. Human dimensions, our health status, our beliefs, our health practices, okay? Each dimension relates with one another and it interrelates with each other. So if one's not functioning well, it could cause the other one to not function well and vice versa. If I'm really good in all, then I should be functioning really well overall. Assessments of strengths and weaknesses help us develop those care plans, okay? And it also helps us individualize them and provide holistic care for the patient. We use the nursing process to plan, implement, and evaluate those plans of care. Another variable that influences health is your own self-concept. How do you look at yourself? How do you perceive your physical self, your physical health, your emotional health? You know, how do you look at yourself? What type of self-care or health practices do you employ for yourself? What risk factors can make us at a greater risk for illness or injury? So things like lifestyles, okay? So if I'm a person who drinks and drives and flies down the road all the time, I'm engaging in, you know, self-destructive behaviors that could increase my chances for illness or injury. Smoking, okay? And are these risk factors modifiable or non-modifiable? So if I'm African American or if I'm Caucasian, okay, and I'm at a higher risk for a certain disease process, that's something I can't modify. But I can modify my weight. I can modify the fact that I smoke. I can modify the fact that I drink. So there are certain things that could put me more at risk or least at risk based on what I engage in. Some of those things I can change. If they're modifiable, if they're non-modifiable, I can't change them. All right, where are we at time-wise? All right, I'm going to have to call it here, guys. I got people coming over, so I got some things I need to get done. But I don't know if I could find another time during this weekend to go back through this stuff or to finish from here. If not, I will definitely try to get at least the rest of 3 and 4 recorded for you guys so that I can put them up on YouTube. 1 and 2 I should have up there sometime today because 2 should be converting as we speak. All right, so once I get those converted and get them up there, and I'll send you the link. If you subscribe to my YouTube channel, I believe you'll be able to see all the links there. So just let me know if you can or you can't once I start sending you out the links, okay? Everything is on YouTube, and once you have the link, then you can get right in there.
The YouTube is under your name?
Yeah, it's under my name. Anybody have questions before I go off?
Thank you very much.
You're welcome.
Appreciate it.
Thanks a lot.
Yeah.
right.
It was helpful.
Thank
Thank you.
you.
Thank you.
Good. You guys have a good rest of the weekend.
Yeah.
And
You as well. Thank you.
if I don't see you before, I'll see you on Wednesday.
Thank
Okay,
you.
have a good weekend.
Yeah, have a good
All right.
weekend.
Have a good
Take
weekend,
care.
everybody.